Hello, everyone. Welcome to another episode of Back to Basics. My name is Dr. Vivian Asamoah. I am a GI specialist based in Houston. If you're watching this, it's probably because you have subscribed to our YouTube channel or you are with us in our little private Facebook group, The Natural Gut Relief, where we talk about everything natural that can relieve gut issues. And every Thursday, we have an amazing guest that comes to discuss sort of important topics that you all have requested for, or we think there's a need for. And today is no exception. I'm so excited, guys, to introduce you to Dr. Ellen Joseph. She's a GI psychologist. She's going to tell us a little bit more about what she does. But the reason I'm very excited about this topic today is one, April is IBS Awareness Month. Two, April is Chronic Stress Awareness Month. IBS, chronic stress, they go together. They pair together. We've talked a lot about food. We've talked about the low FODMAP diet. We've talked about elimination, Mediterranean diet. We've talked about supplements. But let's not ignore the pink elephant in the room. That is stress. That is trauma. That all these things. I'm going to let the expert dive into it. Dr. Ellen Joseph, thank you so much for joining us today.
Thank you, Dr. B. It's so great to be here. Hi, everyone. Thank you so much for joining today. I know for some of you, maybe this is your first time, hearing a psychologist talk about these things. Thank you for your courage to be here and being open. This is a really important conversation and something I feel really passionate about. And I'm eager to dig in with Dr. B.
So glad to help you. We were talking earlier, and I mentioned that one of my patients, who I said I recommended GI psychology, and she was like, what is that? So tell us a little bit about your journey, how you came to GI psychologist, and who are the types of patients you see?
Absolutely. What an important question. So I am a licensed clinical health psychologist with GI psychology. My background is actually kind of all over the spectrum when it comes to health psychology. So I started in primary care, and I actually saw a lot of folks in primary care with different GI concerns. And I came to learn over time and through my training the power of a psychologist on your team when you're coping with different GI concerns, and how much of an impact not only we can have in managing the mental health components related to your GI concerns, but also actually targeting the GI concerns themselves. So it's been quite an honor to be welcomed into folks' journeys with some of these really difficult and for some folks stigmatizing disorders. These aren't necessarily things that we often like to talk about with others, given that we're talking about our poop or our gut or our bloating or just things that other people are saying, oh my gosh, don't go there. I appreciate being welcomed into that conversation because folks really don't have to suffer. There are really effective treatments out there. At our practice at GI Psychology, we're a fully remote practice. We do all telemedicine, so we're able to reach everyone in the United States. And that's something that we really are priding ourselves over because folks don't have access to this care. And the great thing is this can be time limited. So engaging with a psychologist to treat your GI concerns doesn't mean that you're going to be in therapy for years and years of your life.
Yeah.
You get this brief evidence-based treatment that really works and experience relief in your GI symptoms. So I'm excited to dig more into that today.
And into that. Yeah. So many questions are coming up, right? I'm just, because, I'm new to this as well. I refer out, but I don't know the intricacies of what actually happens, but I'm going to put myself in my patient's shoes, right? The first question is going to be, well, I have a therapist or a psychiatrist and a therapist. And so how is this different? How is your specialty different? What additional training did you get? What's your focus?
Such an important question, because sometimes folks come and they say, well, if I already have those folks, why add a GI psychologist? So GI psychologists, especially at our practice at GI Psychology, I like to say we play nice. So we love to collaborate and we love to work with those providers already on your team. So for folks who already have a psychologist or a therapist, and maybe you're working on, let's say you've had anxiety for many, many years, and you're working on those anxiety coping strategies and understanding and building insight around your anxiety, we love that. Keep working with that provider, right? That's super helpful for your care. And you have your psychiatrist who likely is helping you with different medication management, trying to figure out the best way to manage those symptoms from a medication standpoint. Wonderful. Let's have them on the team too, because they have that expertise that we as psychologists don't have. And then you add us, this kind of like question mark to the team.
Mm.
So we are psychologists trained in what are called gut-brain therapies.
Okay.
This is different from what your kind of maybe community mental health provider is trained in. We've learned evidence-based treatments, which means there's a lot of research behind them, both gut-directed cognitive behavioral therapy and gut-directed clinical hypnosis. And we use these treatments together to specifically target your GI concerns. So when you have those other providers on board, you're getting your support from them in their respective areas, and then we're zooming in on that GI component using our gut-brain therapies.
Okay. Oh, that's excellent.
Mhm.
And so there is this additional training that you guys do specifically
Yes,
beyond just general psychotherapy. There
that's
is an additional therapy. And okay, this is an important question because
correct.
this is one from my GI colleagues, right? My peers who always say, I can't find a GI psychologist. I want to refer my patient. I can't. How many of you guys are actually out there? Do you know?
Yes. Oh my gosh. So the last time we were counted, and I'm not sure the exact year, I think it was a couple years ago, 400 internationally.
What?
Is not enough, right? It's not enough. We need more. It's
More.
because so many of us as psychologists and kind of are, and not for everybody, but for most in their typical training, they don't get this specialty training.
Mm.
It's something that at my practice is a huge part of onboarding clinicians is making sure that they are trained and are giving really high quality treatments that are these gut brain therapies because they are different from traditional mental health
They
treatments.
are. They are. They are. Wow. I mean, IBS affects 15 to 20% of the population worldwide. That's huge.
Yes. Yes.
And we know the two major components, the two major triggers of IBS, stress and food, right? And
Yes.
so, dealing this with the food is a hard thing. And then dealing with the stress, it's difficult. I think that's one of the biggest
Absolutely.
challenges for GI physicians and general, primary care and practitioners all around. And so we want to make sure we can help our patients. So what strategies or therapies do you recommend for managing what we now call as gut-brain axis disorders? And maybe you can talk about gut-brain axis disorders just as it relates to GI
Absolutely.
psychology a little bit.
Yeah, let me start with that because I think that will really help us then understand why these gut brain therapies actually work.
Mhm.
So when we think about stress, all of us experience stress. This is like part of our lives, this is part of being humans in this day and age. And stress doesn't just exist in our head. Stress in our nervous system is like an information highway. And our gut brain axis is part of that information highway. So we have our central nervous system, that includes your brain and your spinal cord. And then we have our enteric nervous system, which is your gut. And they are constantly talking. This is like when you're saying, oh, I'm noticing I'm hungry and I want to go eat something. This is when you think, oh, wow, I don't feel well. I think I'm getting a virus.
Mm.
This is the communication system that allows us to know when these things are happening in our gut.
Mhm.
Now, unfortunately, a couple things. We can't see this on a lab or a scope. We can't, do an endoscopy, do a colonoscopy and say, oh, this is what's happening in your nervous system. We just don't have that kind of testing in this day and age yet. So this is where for some folks it can become confusing. Why are my scopes normal, but then I have all these symptoms that are very unmanaged?
Right.
And that's because this gut brain axis, the communication has gotten faulty for some reason. And it can be a combination of things. This can be genetics, this can be chronic stressful life events, infection, diarrhea, and constipation, just to name a few. And what happens is our brain starts to distort and become very reactive to signals in our gut. And this is called visceral hypersensitivity. So we're very sensitive to the sensations in our gut. And then naturally, our brain, in a very, valiant attempt to try to protect us, starts to become very hypervigilant. And that means it's like constantly scanning and looking for these sensations to warn the body that something bad is happening. So folks get caught in this really vicious cycle. We have this visceral hypersensitivity that then compounds the hypervigilance, and then we're stressed about it, right? This doesn't feel good. Something in my body is wrong, and we get stuck in this cycle of pain and worry, which becomes really unhelpful, and we can develop a disorder of the gut-brain interaction or a DGBI.
That's such a great explanation. And I think what, just from a physician's perspective, people have to understand that connection with the vagus nerve that controls a lot of the parasympathetic and sympathetic.
Mhm.
The neuroendocrine receptors we have plentiful in abundance in our gut, serotonin, melatonin as well.
Yeah.
So there is a connection. There's a direct link in terms of the neurotransmitter production, the vagus nerve, and then this vicious cycle, as you're
Yes.
saying, between the visceral hypersensitivity and the hypervigilance of the brain, and all of that connection. So that's really, really important. I just want to help people understand and take a minute, as we have a specialist here, that maybe 5, 10, 15, 20 years ago, a lot of patients with IBS would have gone to see their doctor and they're told, you're just stressed, chill out. Especially a lot of women, right? Because we know it affects a lot of women in our sort of 20s to 40s, and we would probably have been kind of poo-pooed away or shoo-shooed away that, oh, you're just stressed out, really chill out. But today, as we're learning more about disorders of the gut-brain axis, and we are learning more from specialists like yourself, Dr. Joseph, that there is truly a connection. Like there is truly a neurological, a neurotransmitter connection between the
Yes.
gut and the brain. And it's possible that the gut issues are causing some of that hypervigilance, and that hypervigilance is also feeding on the excessive, overstimulation and hypersensitivity that makes you feel even more bloated, that
Yes.
makes you run to the bathroom even more so,
Yes.
and have that urgency and all of that. So truly, there is a scientific
Yes.
explanation for this, and don't really believe that it's all in your head. Now, we also know, Dr. Joseph, that a lot of patients with IBS symptoms have suffered some kind of trauma in their life. Could you expand on that a little bit too?
Yeah, so what we're finding from the more research that's being done, as Dr. V is describing here, that we're understanding these diagnoses more. There are certain things that we see that can be more comorbid with disorders of the gut-brain interaction, including IBS. This can be trauma history, anxiety. We also see for our neurodiverse folks, so folks with ADHD and autism spectrum disorder, sometimes we see greater rates of DGBIs. And we think about, for example, to your piece about trauma,
Mm-hmm.
we know a huge component of a trauma response is a nervous system response.
Yes.
We very inherently as humans have a fight, flight, or freeze response in the face of things that are dangerous. And for our folks who have been through trauma, that system has very understandably so been very activated and very much protected you at the time where you needed it to protect you most. And then what we see is as your life continues and perhaps those threats are no longer present, that system is still going because it still wants to protect you. And when we have that sympathetic nervous system just kind of pumping and activated, then our gut starts to react, because evolutionarily as humans, when our sympathetic nervous system is activated, we get spasms in our bowels. Back to like the cavemen, the bowels would spasm, so they would release bowels so that they could run and get away really fast. So our gut is very connected to this experience. So when we have this kind of sensitivity and exacerbation of that sympathetic nervous system, our gut is involved, our trauma response is involved, and we really want to work to down regulate that system and help you get to a place where you can experience more the parasympathetic nervous system that you were describing earlier.
Excellent.
So to your point, biologically, it makes a lot of sense why these disorders go hand in hand.
It makes a lot of sense.
Yes. And if nothing else, for anyone to take away today, it is not all in your head, as Dr. V said. Like there really are these components that speak to why you're having these symptoms.
Yeah, absolutely. So, so many questions are in my head right now, but let me ask you this. I want to be sure that I'm referring that, knowing that we have 400 GI psychologists out there to our disposal in the world, nationwide, internationally. But I definitely enjoy working with you. We've referred some patients to you, and we have had some amazing response and amazing feedback from your group. I want to be sure for all people, everyone watching us today, those who are patients of mine, and perhaps those physicians in the group who have patients with similar symptoms, which patient is the best candidate for GI psychotherapy? who should we actually be referring out? Now, you even
Mhm.
mentioned ADD and ADHD, and I see a lot of patients with ADD and ADHD who also have IBS, right? But I
Mhm.
don't always make the connection that, hey, I should refer. But expand on that. So that will really help us out.
So here's the thing that I think can often be a misconception, and understandably so when we're thinking about referring to a mental health provider.
Mhm.
You don't have to have a mental health diagnosis to see a GI psychologist for
Yeah.
your disorder of the gut-brain interaction. And I think often, and understandably so, when folks hear, I think you should go to the psychologist, it's going, what, why?
Right.
What are you saying is going on?
Yeah.
We see folks are way of both going on. We have a comorbid mental health diagnosis and a disorder of the gut-brain interaction. And then we also see folks for whom perhaps they've gone through your great program, Dr. V, they've worked with their dietitian, but things just still quite aren't where they want it to be.
Yeah.
Bring them over because we have some great treatments that will be absolutely effective for them that
Mhm.
don't require a generalized anxiety disorder diagnosis or a trauma diagnosis. We can treat you simply for your DGBI. So any of those folks could be a good fit.
Okay. All right. Excellent. Excellent. So it's anyone, I
Mhm.
would say, with chronic gut symptoms, right?
Absolutely.
On a day to day,
Absolutely.
not finding relief,
Absolutely.
often finding themselves anxious, searching for the
Yeah.
bathroom, really confused and frustrated about even what to eat because they've now so over restricted their foods and they're only eating 10 things. Sometimes even extremely apprehensive and scared to try new foods. I think we've sent you a couple of patients like that
Mhm.
where we're really trying to avoid, prevent them from getting into this avoidance restrictive eating disorder, which we sometimes see. And
Yes.
so, that, and, patients with chronic abdominal bloating and pain
Yes.
who've had extensive workup. And we think that definitely there could be a DGBI connection here.
Yes.
What should they expect on a first visit and subsequent visit? What kind of therapy? How's that first initial discussion and
Yeah.
what is often proposed?
Absolutely. So I think anytime often when you're working with a mental health provider, not always, the first appointment really is this really thorough intake process. So we really learn more about your symptoms, what triggers your symptoms, when do they get better, when do they get worse, what are those symptoms? So we're going to ask the nitty gritty. How
Mhm.
often are you going to the bathroom? What do your poops look like? Because that's helpful information for us to know. We'll
Mhm.
ask about your life broadly, who's in your support system, are you working? How have your GI concerns impacted those areas of your life? Because I think to your point, Dr. V, folks who are coming to us, life is not looking the way they want it to. And it's important for us as your treating provider to understand that so we can help you work to get that back.
Mhm.
And then towards the end of that initial appointment, we talk a little bit about what we think is going on diagnostically. We talk about goals for treatment, and then we go over treatment approach. And I'd love to talk a little bit about that here because I'm sure a lot of folks in this call are like, so what do you do in this treatment?
Yes.
Yes. So the American College of Gastroenterology actually gave its like stamp of approval and gold standard treatment for both gut-directed cognitive behavioral therapy and clinical hypnosis for DGBIs like IBS. So those are the main treatments that we utilize. For those of you who are familiar with cognitive behavioral therapy, and perhaps you're receiving that treatment right now, where this differs is we really use that component of cognitive behavioral therapy, which is that we have unhelpful thoughts that trigger difficult emotions and cause us to act or behave in a way that's not helpful to us. We
Mhm.
really look at that triangle in the context of your GI symptoms. So let me give an example here. Let's say you're somebody for whom you get that rumble in your gut when you wake up in the morning, and your immediate thought is, how am I going to make it through today? There's no way. I have this big presentation. It's over lunch. Am I going to be able to eat lunch? What if I eat lunch and then I have to run out in the presentation? And then the mind just starts going. And then naturally you feel incredibly anxious and worried. And perhaps as a result, you call out of work
Right.
and try to prevent that. We work with you on what to do when these situations come up using the gut-directed cognitive behavioral
Mhm.
therapy.
Mhm.
Now, clinical hypnosis. I might have some folks on the call going, "Oh gosh, what's the woo-woo clinical hypnosis?" It is not portrayed well in our society. So think about like entertainment hypnosis. I don't know if other folks on the call, I know at my like senior night at high school way back when, they brought in a hypnotist to hypnotize people in my senior class, and they were doing the most embarrassing things on stage. They were like quacking, they were like yelling. It was a whole spectacle.
Okay.
We do not do that. That is not clinical hypnosis. Clinical hypnosis, we support you in going to what's called a trance on purpose, never by accident. No watch in front of the screen, no snap of the fingers, anything like that. And a trance is simply a combination of concentration and imagination. And in fact, all of us experience this naturally in our lives. So if I have any athletes on the call, that flow state that we can get when we're playing a game, maybe some runners on the call who really get into the groove and it's like time kind of melts away, everything around you melts away. Your kids on social media when they don't even recognize that you're in the room next to them, or even if you listen to podcasts on the way to work, and you get to work and you go, oh wow, how did I get here? I don't even remember.
Yeah.
You were in a very natural trance-like state. So we just teach you how to harness this power to help create change in your body. And we use what's called suggestions, and they're really targeted to the gut. We promote healing. We promote positive changes and new sensations. And as a result, you feel more in control of your symptoms. So many people think when we do hypnosis that we as the provider are in control, but that's not the case. You're in control the whole time, and learning how to use these strategies.
Wow. Okay. Okay. So cognitive behavioral therapy, gut hypnosis, we've talked about. I'm sure there's a lot of mindful work in terms of mindful breathing exercises. That's probably a foundational piece right there.
Lots of
Any other,
relaxation.
lots of that, right? Right.
Yes.
Right. And anything else that you guys do differently, or are those sort of the main features?
Those are our main treatment options. We do have some folks, because we all, as our providers at our practice, have that generalist training background. So we have a couple folks trained in EMDR for folks who have a trauma history and are looking for that treatment. We have a
Gotcha.
couple providers who use acceptance and commitment therapies, which is a third wave cognitive behavioral therapy treatment, which can be really helpful. So you have providers who have a couple different approaches that they might incorporate in a treatment based on what really fits given your symptoms and what might be helpful for you.
Fantastic. Oh, this has been extremely helpful. How long do patients usually work with you for? What's that
Mhm.
average span?
Absolutely. So it varies for each patient, right? We, of course, base ending treatment on a collaborative conversation between the patient and provider
Mhm,
about when they feel like they've met their goals and they feel ready to move on from treatment. For
mhm.
folks who are just coming to us with a DGBI, so not also trying to address a comorbid mental health disorder at the same time, so just your IBS, we see
Mhm.
about 10 appointments on average. And in fact, I want to name this too, 8 out of 10 people report significant symptom reduction after
Wow.
treatment that also lasts. So this isn't something that just because you end treatment, it all falls off. We see that these improvements really last. So that's a really high efficacy rate when we think about the
Very good.
different treatments we can
Yeah.
offer.
No, that's very high because, in
Mhm.
terms of helping our patients with chronic gut issues, IBS being one, we only see an improvement in symptoms in about 30 to 40% with the conventional
Right,
therapies that we have right now. So we
right.
know that integrating this definitely increases that success rate. So that's really,
Yes,
really good. So
yes.
about 10 visits, how often are the visits?
So at our practice, we meet with folks weekly for 45 to 50-minute appointments.
Okay.
We do make sure that, because we know people have lots of schedules and things that they're juggling, that we reserve your time for you. So when that's landed on between you and your provider, that's your time each week to make sure that we can meet that weekly treatment regularity.
Got you. Got you.
Mhm.
Excellent. Okay. And very often at the end of these treatments, once you guys have really focused on the GI therapy component, you often probably connect with, if there is a mental issue, or if there's an underlying anxiety or depression or bipolar issue, you very often will connect with their therapist at base to sort of
Yes,
coordinate care and continue the care. And okay, so that's that
absolutely.
communication. The doors are open, lines of communication are open, and there's a lot of conversation to help that person. So that's really, really good.
Absolutely. We really believe that in treating your disorder of the gut-brain interaction, that we really need to take that team-based approach,
Yeah.
and we value that at our practice, and even though we're a private practice, we're reaching out to those folks on your treatment team at minimum at the beginning and end of treatment, and also throughout as needed, to, 1, help you feel like that we're all on the same page about your care, and 2, to help us work together to problem solve any challenges that might come up. So that collaboration is always there. Yes.
Awesome. So, Dr. Ellen, I know that some patients will be always ask and be concerned about cost, right? Like if they have insurance or if they're self-pay.
Mhm.
Tell us a little bit about the way your practice is structured, the GI
Yeah.
psychology practice. Yeah.
Important question. So we are an out-of-network provider at GI Psychology, which means that we don't take insurance at this time.
Mm-hmm.
We do have members of our administrative team that can help with seeking out various support through your insurance. So for some of our patients, we find that when they submit to their insurance for an out of a network mental health provider, they get about half of the cost reimbursed.
Okay.
And then we also have something called a single case agreement or gap exception that exists with a lot of insurances,
Mm-hmm.
where our admin team will support the patients in petitioning to their insurance, say, okay, well, then find for me somebody in network who's near me, who's trained in gut brain therapies.
Right.
And 10 out
Right.
of 10 times the answer is we don't
We
have somebody.
yes. Yeah.
So our administrative team helps the patients fill out the paperwork to submit
Yeah.
to their insurance to have our services reimbursed and covered as if we were in network. We
Okay.
also have some group options for folks for whom individual treatment might be difficult financially, where the group options will be a little less expensive, where you'll get a lot of the skills that you would learn in individual treatment.
And so a lot of benefits of group therapy as well, right? So
Absolutely.
many advantages. So I think that's so you have several options available. Are patients
Absolutely.
able to use like an HSA card or an FSA
Yep.
card? They're able to use that
Absolutely.
as well.
Yep.
Wonderful, right? Yeah. So I think there's definitely a huge, tremendous value in what you guys are offering as a group.
Thank
And
you.
for patients going into, multiple GI offices, getting that third, fourth colonoscopy that never finds anything. Um,
Right.
Invest in yourself, right? There's value
Mhm.
here. At least try to address the underlying stressors and work with an expert who really understands GI psychology and how this may be impacting your overall gut health. This is, I think, a tremendous, huge impact for our patients. And I think a huge relief to GI doctors because we're not therapists, guys. We're not.
Right.
Can't handle
Right.
all of that. So we
Absolutely.
yeah, it's wonderful to have that expertise that can really use an evidence-based integrative approach to help our patients.
Yes.
Yeah.
Yes. Absolutely.
I wanted to get just one final comment, Dr.
Mhm.
Ellen Joseph. This has been such a tremendous, very informative discussion, and I think a lot of people are going to enjoy watching this. And guys, please share this with friends and family who may be suffering from chronic gut issues. But there are a couple apps out there, right? There are apps out
Mhm.
there that promote that actually are sold as this is the app that's going to help you with GI psychology if you have irritable bowel syndrome and whatnot. So there are two that are very common in the GI world. One is Nerva, the other is
Mhm.
Mahana, right?
Mhm.
And so these are apps that kind of, I think it's kind of everything is automated, and you
Yep.
kind of, you kind of follow through a process
Yes.
with the system. Tell us what are your 2 cents on the apps? Yes or no? Where
Mhm.
would you advise someone start with that? Would you advise they continue with that after they've
Mhm.
worked with you? What's been your experience so far in terms of
Yeah.
patients' response? Yeah.
It's been mixed. So I have folks who come to treatment with me and they'll say, I've done the Nerva app, I really liked it, and I need a little bit more. The
Okay.
feedback that I get often from patients is our treatment is a little bit more individualized because we can really target hypnosis for the specific symptoms that the patient is experiencing. And then
Mhm.
we're adding the CBT component as well. So I think
Okay.
when you're thinking about coming to somewhere like GI psychology, you're going to get a very individualized and targeted treatment to your concerns. With that
Mhm.
being said, I think these are great resources. So if you're someone that's like, I'm just not sure I'm ready to dig in yet to this treatment, let me try the app first and see what I think. I
Yes.
think that's always a great place to start. It is I know Nerve is a cost-based app, so that's something to take
Yes.
into account. You do have to pay for.
Yeah.
And know too, even if you don't have a lot of success with Nerva, that doesn't mean that our treatment won't be successful. So what can also be really helpful in working with a GI psychologist is we can work through any of the challenges coming up.
Mhm.
I also have folks who continue to use these apps even after we're done meeting, because now
Yeah.
that we've really worked together and helped them get into the groove of what hypnosis looks like for them, and then incorporated those CBT skills as well, then they're off and running afterwards and using it more as like a maintenance.
Right, exactly. There's a better understanding. They understand how
Yeah,
it works for them. So I think that's excellent. The Mahana app is actually covered through for some insurance plans. We do see,
wonderful.
so the Mahana one is covered, and I will post that. But I like that. Start and give it a try, right? But it
Mhm.
doesn't really encompass all of what you do and your team does,
Right.
right? Also, a nice way to also continue therapy on your
Yes.
own long term. So I
Yeah.
like that a lot. This has been a wonderful conversation, very
Yeah.
insightful. It's going to be helpful to so many people out there. I wish we could, clone you into 1,000 more people.
Me as
So
well. Me as well.
you could help a lot more of our patients with GI issues, chronic GI issues. I found that patients have come with great feedback. They've
Right.
really enjoyed working with your group. They've worked with different psychologists in the group, and it's always been very positive. Dr. Joseph, where can we find you? Where can people find you?
Yes, great question. So first, I want to give a little plug to Dr. V, since she's also being so complimentary of me. I'm so grateful for you and giving us as psychologists a platform to really get this word out that these treatments exist, and being so collaborative and working with us to really treat patients as the whole people that they are. We're just so grateful to work with you and other providers like you who have this mindset and this ability to really get patients connected to things that work and to really help them. So just thank you for that and your support for our work as well. If you all are interested in GI psychology, you can go to our website, www.gipsychology.com. You can just peruse through. We have patient testimonials, we have some basic information and FAQs. You'll also see on there, we provide a free 15-minute phone consultation to folks who may be interested in treatment. So know if you even just kind of want to talk to somebody, see if it'll be a fit, we'll do that for free for 15 minutes. Go through your concerns, talk about some logistics, and see if we're a right fit for you. So you'll see a tab on there where you can do that, or you can go to the contact us page, send our admin team an email or a message, or give us a call. So lots of different ways. I suggest starting with the website. You can also find us on LinkedIn. We have a page, GI Psychology, if you're somebody on LinkedIn. We also have our Instagram. I believe it's GI Psych USA, if I'm remembering that correctly. So yes, find us on the socials, see our website. We'd love to get connected with you, and please reach out with any questions.
Awesome. Don't worry if you didn't remember. You sent me all the links, and I'll be
Great.
sure to post them all as
Great.
we are.
Thank you.
Yes, I'll be sure to post them all, and and everyone will be able to copy down the information and start perusing through the website. The website is actually very, very user friendly. I've checked it out myself. Very easy to use. Very easy to schedule that initial call, that
Mhm.
complimentary call. I think anyone watching this today should take advantage. Just have that initial call, right?
Yeah.
Have that initial call. See what they can do for you. Check out the other apps like Mahana and Nerva, and
Mhm.
then take the next step forward, right? Decide whether this is something that could be beneficial for you. Try something different. Don't do what you've always been doing if it hasn't been working, right? And let's see if
Absolutely.
we can help. Dr. Joseph, thank you so much for joining us today. Um,
Everybody.
you. For everyone watching us, I hope you enjoy this. I really did. My name is Dr. Vivian Asamoah. I'm a GI specialist in Houston, Texas. Our practice combines the best of both worlds, conventional medicine and a more integrative, holistic approach focused on food first. We present our topics every Thursday on Back to Basics. Thanks for joining us and hope to see you again soon. Bye.